1. Which of the following best describes the mechanism of action of omeprazole? A. Histamine H2 receptor antagonist. B. Inhibitor of the HK-ATPase enzyme. C. Competitive antagonist of acetylcholine. D. Non-selective beta blocker. 2. Which cytochrome P450 isoenzyme is primarily responsible for the metabolism of warfarin? A. CYP2D6. B. CYP3A4. C. CYP1A2D, CYP2C9. 3. A drug with a half-life of 8 hours is administered. How long will it take to reach approximately 95% steady-state concentration? A. 8 hours. B. 24 hours. C. 32 hours. D. 40 hours. 4. Which of the following statements about first-pass metabolism is correct? A. It increases the oral bioavailability of most drugs. B. It only occurs in the liver. C. It occurs primarily with intravenous administration. D. It may significantly reduce the concentration of active drug. 5. Which class of antibiotics inhibits bacterial protein synthesis by binding to the 50S ribosomal subunit? A. Aminoglycosides. B. Macrolides. C. Tetracyclines. D. Fluoroquinolones. 6. What is the main therapeutic use of digoxin? A. Hypertension. B. Angina pectoris. C. Atrial fibrillation. D. Deep vein thrombosis. 7. Which of the following diuretics is potassium-sparing? A. Furosemide. B. Hydrochlorothiazide. C. Spironolactone. D. Mannitol. 8. Which one of the following is a prodrug? A. Paracetamol. B. Lisinopril. C. Ibuprofen. D. Metformin. 9. A competitive antagonist will shift the dose-response curve of an agonist in which direction? A. To the left. B. To the right. C. Upward. D. Downward. 10. Which antidiabetic agent acts primarily by increasing insulin sensitivity in peripheral tissues? A. Sulfonylureas. B. Metformin. C. Acarbose. D. Sitagliptin. 11. What is the primary mechanism of action of statins? A. Inhibition of cholesterol absorption. B. Inhibition of HMG-CoA. A reductase. C. Activation of lipoprotein lipase. D. Enhancement of LDL receptor degradation. 12. Which of the following is a potential adverse effect of aminoglycosides? A. Nephrotoxicity. B. Hyperkalemia. C. Photosensitivity. D. Hypoglycemia. 13. The term bioavailability refers to Rhi. The potency of a drug. B. The duration of drug action. C. The percentage of drug reaching systemic circulation. D. The rate of drug metabolism. 14. Which of the following is used as a reversal agent for benzodiazepine overdose? A. Naloxone. B. Atropine. C. Flumazenol. D. Protamine sulfate. 15. Which class of drugs is contraindicated in pregnancy due to teratogenicity? A. Beta blockers. B. ACE inhibitors. C. Proton pump inhibitors. D. Antacids. 16. Which of the following increases the risk of lithium toxicity? A. Use of antacids. B. High sodium intake. C. Thiazide diuretics. D. Beta blockers. 17. Which statement best defines volume of distribution? A. Volume of plasma cleared of drug per unit time. B. Total body fluid volume. C. Hypothetical volume in which a drug is distributed. D. The amount of drug in the plasma. 18. Which of the following is an example of zero-order kinetics? A. Phenytoin. B. Penicillin. C. Ciprofloxacin. D. Lisinopril. 19. Which of the following is considered a narrow therapeutic index drug? A. Metoprolol. B. Warfarin. C. Omeprazole. D. Acetaminophen. 20. Which neurotransmitter is primarily affected in Parkinson's disease? A. Acetylcholine. B. Dopamine. C. Serotonin. D. GABA. 21. What is the main route of excretion for aminoglycosides? A. Bile. B. Sweat. C. Renal. D. Pulmonary. 22. Which class of drugs is most likely to cause extrapyramidal side effects? A. SSRIs. B. Antipsychotics. C. Benzodiazepines. D. Beta blockers. 23. What is the function of the excipient magnesium stearate in tablet formulation? A. Binder. B. Lubricant. C. Disintegrant. D. Diluent. 24. Which of the following is the most appropriate treatment for methanol poisoning? A. Atropine. B. Ethanol. C. Activated charcoal. D. Acetylcysteine. 25. Which phase of a clinical trial primarily assesses drug efficacy and dosage? A. Phase 1, B. Phase 2. C. Phase 3. D. Phase 4. Knowledge Assessment of Pharmaceutical Sciences. The Knowledge Assessment of Pharmaceutical Sciences, or KAPS, is a comprehensive examination designed to evaluate the knowledge and understanding of internationally qualified pharmacists seeking registration in Australia. Administered by the Australian Pharmacy Council, or APC, the KAPS test assesses foundational and applied knowledge in pharmaceutical sciences, including pharmacology, pharmaceutics, medicinal chemistry, and therapeutics. The exam ensures that candidates meet the required standards for safe and effective pharmacy practice in Australia. It is typically taken by pharmacists who have completed their education outside of Australia and are pursuing certification to practice within the country's healthcare system. Here are the top 5 beneficial uses of the KAPS exam. 1. Pharmacist registration in Australia. The KAPS exam is a critical requirement for internationally qualified pharmacists seeking to become registered in Australia. It ensures candidates meet the Australian standards of pharmaceutical knowledge and practice. 2. Validation of academic credentials. The exam verifies that the candidate's educational background aligns with Australian pharmacy curricula, providing assurance to licensing authorities. 3. Career advancement. Successfully passing the KAPS exam opens doors to professional opportunities in Australia's healthcare system, including community, hospital, and industrial pharmacy roles. 4. Eligibility for internship programs. Passing KAPS qualifies candidates for supervised practice programs, a vital step toward full registration as a pharmacist in Australia. 5. Global recognition. The KAPS credential enhances a pharmacist's international profile, signaling competence and readiness to practice in other countries with similar standards.